Hello everybody. Hope you would have seen the pelvic inflammatory diseases as the first cause of female infertility. I have discussed about this in my previous video. Let us see the second cause of female infertility today in this video, the polycystic ovarian disease, PCOD. So, what are all the major causes for the PCOD? One is genetic cause and another one is hormonal cause. Under genetic cause, generally the diabetic parents, either of the parents or both the parents, if they have diabetes mellitus, naturally their kids will have a probability of developing PCOD. This is genetic cause. Under hormonal cause, the increased level of testosterone, that is the male hormone, is the ultimate reason for the development of PCOD, and it is hindering the ovulation and it is affecting the menstrual cycle. So, how this happens? Actually, the increased level of testosterone is because of the insulin resistance. The insulin resistance is developing in female by the following mechanism. Insulin is a hormone produced by pancreas. This is utilized for converting the blood sugar into energy. That is, the sugar is derived from the food what we are taking, and this is converted into energy. So, its role is playing a metabolic activity in the carbohydrate metabolism, fat or protein metabolism. So, when the cells of our body unable to use insulin properly, then the body's demand for insulin increases. This in turn induces the pancreas to produce more and more insulin. This increased insulin secretion not only utilized for energy conversion, this also triggers the ovary to produce the male hormone testosterone. So, this automatically affects the ovarian function. Then the follicle development is arrested. Instead, the polycystic ovaries developed. What are all the signs expressed or can be seen in the individual's face? I mean, by seeing the face of the girls, we can identify probably the girl may have developed PCOD. Initially, we should see the head, loss of hair, and bald spots in the scalp. I mean, due to profuse hair fall, baldness developed, and blackish patchy discoloration over the face, and male type of hair growth on upper lip as well as on the chin, and acne, pimples on the face. So, these are all the signs developed in the female face. And what are all the symptoms? Individuals communicate the symptoms of headache, frequent headache, and profuse menstrual discharge or irregular menses. The menses will not come, or if it comes, it may prolong for many days with profuse bleeding. It may result in profuse loss of blood and anemia. And another symptom, dysfunctional uterine bleeding, continuous bleeding without stopping, even for 30 days, 60 days, something like that. So, it may end up with severe anemia, and painful menstruation, dysmenorrhea, pain felt in lower abdomen associated with nausea, vomiting, sometimes giddiness. The children may not be able to do even their daily work, or even they cannot even a small quantity of food. That much sufferings during menses. So, these are all the common symptoms due to PCOD. So, the next, how this increased insulin is developed at this age? Because of high calorie food intake. The children are actually habituated today to take more fatty food, cakes, confectionaries, biscuits, cream biscuits, high calorie chocolates. So, these are all not at all our nativity food. So, if these type of fatty foods are taken more and more, automatically this fat is very tough to get digested and converted into energy. So, development of obesity. So, this obesity causes pot-belliedness in the women and increased sugar in the blood circulation. This will automatically increases the demand for insulin. So, healthy lifestyle is very, very important. Whatever food we take, we get the calorie. That calorie should be burnt out. We should do proper exercises to burn out our calories. Otherwise, it will end up in obesity, then we will automatically invite the PCOD. Rather than treating the disease, it is advisable for us to prevent the disease by following better lifestyle and good diet habits. Starchy foods could be controlled, needed starch alone can be managed. So these are all the food styles to be followed by the kids. Naturally, homemade foods are advisable rather than buying foods from hotels. So the parents should actually educate our children to follow healthy lifestyle and also healthy food habits. They should be trained to do some work at least to burn out their calories. This is how we can manage. Okay, the obesity due to eating habits can be controlled by lifestyle modifications, but how this obesity develop in other way? If the children have hypothyroidism, I mean thyroid disorder, if there is deficiency in the thyroxine, then automatically there is obesity. This obesity also actually followed by PCOD. So how to manage this thyroid disorders? Instead of levothyroxine therapy continuously, homeopathic medicines are helping actually to stimulate the thyroid gland and regulates its function. Automatically the thyroxine hormones are corrected without having hormone supplement. And desire to eat, whatever advices given by the parents, sometimes the children are getting irritated. Why you are prohibiting me to eat? Then the homeopathic medicines, wonderful homeopathic medicines are there to control the desire to eat. Naturally, the children's mind will be altered to avoid the unwanted things and to reduce the habit of taking more and more high calorific food. This possible with the help of homeopathic medicines, because homeopathic medicine specifically acts on the mind and it controls the emotions, desires, everything, and it channelizes the attitude of the children towards their eating habit. So many patients proved successfully with the application of homeopathic medicines. They had tight control over their appetite and they were habituated now. Many homeopathic medicines were helpful in the patients having good control over the unwanted appetite. The following medicines are useful in treating PCOD in my experience. If it is right-sided PCOD, I mean if the right ovary is cystic and the left ovary is normal, then the following medicines may be useful: Apis mellifica, Lycopodium and rhododendron. If the size is voluminous, large, rhododendron will be helpful. If it is left-sided PCOD, Lachesis, Murex, some Overinum also may be useful. If it is of bilateral PCOD, Overinum, and ovarian extracts as sarcodes can be applied to regulate the functions of the ovaries. Generally, pulsatilla, sepia, colosynthis will be helpful if polycystic ovarian disease with painful menstruation. So these are all the important medicines which will help us to solve the problem of PCOD. And in addition, constitutional and individualistic approach also very important to choose the right remedy. Thank you.